have all these women and gentlemen behind me and so many other people who are here in the room today. I want to thank them for coming together. I understand that some of the community corrections officers are here this week to talk about reducing recidivism, and we're very fortunate that they were willing to join us today to show their strong support for this legislation. I also want to welcome Gary Moore, who's here, who's Director of the Ohio Department of Rehabilitation and Corrections. Thank you, Gary. And also John Matthews. Raise your hand, John. John's head of the Ohio Faith-Based and Community Initiatives. You and I said, John, you got to stick around because we're going to be talking about your issue. And he has headed this up in his own county, Marion County, Ohio, over the years. We've had a good chance to work together. 67% of people who are incarcerated are back in the system within 3 years. Think about that. 67% of the people who get out end up within a few years going back into the system. These costs are tremendous. Social costs, economic costs. We need to be tough on crime, but we also need to be smart on crime. And that's what this legislation has been all about. The high rates of recidivism, of course, translate into thousands of new crimes, huge new costs to our communities, to our families, and to our country. We have to balance the overwhelming need for assistance around these issues, of course, with the tremendous financial burdens our country is currently faced with. But we also have to understand that the burdens our country is faced with is partly because of the way the system's not working now. Our criminal justice system costs, fall on our citizens, our taxpayers, public safety risks, inefficient use of resources. So we need more successful reentry strategies because they make good fiscal sense. In fact, when you look nationally, only Medicaid is growing faster than the cost for corrections. That's certainly been true in the state of Ohio. One data point we saw shows that correction spending now tops $50 billion. That's 1 out of every 14 discretionary dollars. In Ohio, by the way, it's climbed 21% between 2000 and 2008. So these are fiscal issues as well as social and community issues. I was the author of the original Second Chance Act in the House in 2004. It didn't actually get enacted into law until 2007. Over 11,600 people have received reentry services through the Second Chance Act. 58% of people participating have gotten jobs, which is a big part of the plan. It's not just about the importance of mental health and drug rehabilitation and housing. It's also about connecting people with the private sector and getting jobs during this tough economy. It's evident that the current Second Chance Act is making an important contribution to public safety, to fiscal concerns. I hope that the committee on both sides of the aisle will work together to help get it through the committee, through the markup, and get it onto the Senate floor and then onto the House floor so we can reauthorize this important legislation.